Hello, everyone. I welcome you all to this first episode of the year 2024. This is an Insight webinar hosted by eHealth Africa. It's a public health series that enables insightful conversation with public health professionals on public health issues and pathways to improve public health delivery. I welcome you all. My name is Lucy Okoye. I work with eHealth Africa. I'll be the one to moderate today's session. Permit me to just give a brief layout of our program today. We're going to be having three professionals talk to us. It's going to take a form of question and answer, and then we'll have the participants and audience send in their questions and in the Q&A session. Please, we invite you to send these questions as our conversation goes on. Just to provide a little background to today's discussion. The world today is actually impacted by emergencies in an unprecedented scale. WHO has reported that between 2010 and 2016, over 1,000 epidemics has been recorded across 168 countries. In fact, the more recent data is showing over 1,200 in 188 countries. You agree with me that these emergencies has major impact on the health and well-being of the communities. It also has impact on the resilience of our health system, as well as the national economies of these communities. It also, most importantly, affects the progress towards achieving the Sustainable Development Goals. Again, these SDGs should be achieved by 2030. And this is 2024, and we have just 6 years to go. The question now is, how prepared are our health system? Today, we're going to be narrowing down to the laboratory system. So strengthening health laboratory becomes very essential, in the early warning, surveillance, as well as the response to the response system, to these epidemics or emergencies. Also, it is a core capacity of the international health regulation. It's actually a requirement that member states should, develop capacity, national capacity, to be able to dictate, to be able to investigate and report any public health threat that is of international concern through WHO to the world. So against this backdrop, we actually had another data from WHO in the just released regional strategy on diagnostic and laboratory services and system 2023 to 2032, stating that only 47% of the world population has access or little or no access to diagnostic services. It's also reported that 30% of health facilities has the required equipment and reagents to conduct laboratory testing, diagnostics tests. So you can see that data. And then that is why today's webinar will be looking deep into how prepared are our laboratories for any pandemic, for any potential pandemic, for any emergencies. So today we're going to be discussing strengthening public health laboratories for pandemic preparedness. We're going to be focusing on, most importantly, how effective or how accurate the diagnosis will be when we eventually have maybe any emergency. So it is now time for me to, having given this background, I want to check if our Deputy Director of Programs is online to actually give us a welcome and opening remarks before we move ahead. Please, David, are you online? Hello, David. Okay, so anytime David is online, we'll have him say a word or two to us. So now I want to quickly introduce our panelists. Like I said, the discussion is with public health experts. So we have three panelists that are going to be speaking to us today on these subjects, preparing laboratories for pandemic preparedness. How prepared are we? So the first is Mr. Manasseh Rubainu. Mr. Manasseh is the Medical Laboratory Director with Peak Medical Laboratories Limited. He's retired Head of Laboratory Services with the University of Abuja Teaching Hospital. He's also in the leadership of the National Lab Technical Working Group in Nigeria. Mr. Manasseh is currently the chairman of the National HIV Laboratory Task Team of the Federal Ministry of Health, and also the Medical Laboratory Science Council of Nigeria's In Vitro Diagnostic Technical Committee. He has served a lot of committees. He chaired the Medical Lab Equipment Sterilization and Harmonization Guidelines, and he has been the chair of the evaluation of HIV testing technologies with the Federal Ministry of Health from 2010 till date. Also, Mr. Manasseh is a fellow of the West Africa Postgraduate College of Medical Laboratory Sciences. He's a faculty of the Molecular Diagnostic and Translation Cell Sciences. He's also a fellow Institute of Management Consultants, and also he's a fellow of Association of Medical Laboratory Scientists of Nigeria. You're welcome, Mr. Manasseh. Mr. Manasseh will be joined by Joan Hassan. Joan Hassan is a technical coordinator, EPI Laboratory in Kenya Medical Research Institute, KEMRI. Joan is a quality-focused technical supervisor at KEMRI Polio Laboratory. She holds a BSc in medical microbiology and an MSc in molecular medicine. She brings over 2 decades of experience in medical diagnostic testing and research. Her expertise includes cell culture, molecular diagnosis of poliovirus, and virus isolation. She is skilled in training, protocol review, research dissemination, and laboratory management. She is committed to advancing the field of medical microbiology. They will be joined by Wayne Howard. Wayne Howard is a senior medical scientist with the Center for Vaccine and Immunology, National Institute for Communicable Diseases, with the Division of National Health Laboratory Services, Sandringham, South Africa. Wayne has been involved in poliovirus surveillance and eradication efforts in the Center for Vaccines and Immunology for over a decade. As a biologist and molecular biologist, the poliovirus eradication efforts have had him working with WHO and the National Department of Health. Wayne is involved periodically in training delegates from African countries in poliovirus laboratory surveillance techniques. He is trained in high containment laboratory operations and is now branching out into immunology. His PhD is focusing on the nicotinamide synthesis pathway and macrophage polarization in COVID-19. So you're all welcome. We thank our panelists, our distinguished panelists, for making our time to be here with us today. Before we go into the meat of the day, we just have a short break. We want to share with you just a minute and 18 seconds video on one of our products. This is just to showcase what we have done in vaccine direct delivery in Sokoto State. Over to you, media crew.
Sokoto is one of the states that have the lowest figures in terms of immunization coverage. Though there has been a lot of improvement over the years, it's a work in progress. Many stakeholders are coming together using different kind of methods to ensure that the demand for these immunizations is increased.
Wallahi ni fata na Sokoto ta hi kowace state a Nigeria, datan mu ta hi ta kowa. Ya zan muna samun vaccination, yaran mu su samu lahiya, shan inna yaban Nigeria su measles, yellow fever dai da sauransu. Yanda sauran kasashe da suka ci gaba, mu ma ci gaban mu ya kai wannan, ya zama mun zama safe, ba mu da wasu matsaloli sai dan abin da ba a rasa ba.
Thank you very much. I hope we got something. What interested me there was the fact that there was an increase in the coverage, 18% increase. They started at 3%, and based on this support that is provided through BMGF funding through the states, and then they were able to make that landmark coverage, additional 18%. That was great. So let's come back to the meat of today. We're looking at strengthening public health laboratories for pandemic preparedness. Again, you know, laboratory medicine happens to be like the backbone of public health. You cannot do so much if you don't get to diagnose. Diagnosis is like getting to the root cause, be it clinical or public health, the root cause of whatever it is. So that is why we want to, look into this role of laboratory, especially in the developing countries where we actually fall into. So the first is to please remember to drop your question in the Q&A, and then we'll return to it after the presentation by the panelists. Into this role of laboratory, especially in the developing countries where we actually fall into. So the first is to please remember to drop your question in the Q&A, and then we'll return to it after the presentation by the panelists. Into this. Hello. Yeah. Hello. Moshood, please confirm you can hear me. I saw that bring.
Yes.
Okay, so please, the first question is, I'm going to direct this question to the panelists, the three of them. I'll start with you, Mr. Manasseh. Please, just to give an overview, what's the general overview of the role of laboratory in public healthcare system? Would you want to start, Mr. Manasseh? Hello. If you are speaking, you are muted. Can't hear you.
Can you hear me?
Yes, we can hear you now. Please go ahead.
Well, I didn't hear your question.
Okay. I said, could you please give an overview of the role of laboratory in public healthcare system? What's the role of lab?
Well, we all know what a laboratory is. Laboratories are just rooms equipped to perform experiments. What we do in laboratories is to do experiments that we call tests. And a test is a simple, standardized, or reproducible experiment. When you standardize an experiment, it is reproducible, you deploy it as a test. And therefore, at all times when you are doing a test, you are looking for something unknown. Now, these unknown could be disease-causing agent, could be changes in the physiology of human being, physiological functions, what we describe as pathology. So laboratory is very central in providing the information or data response that is responsible for determining the state of health of people in a community. For public health purposes, you actually determine what is the cause of a disease, the reservoir of such, and how it moves from one place to another is all dependent on laboratory data. So laboratory is very central to everything about the state of health of individuals in the society. It could be a curative or preventive aspect of healthcare delivery. Largely depends on laboratory data.
Thank you very much, Mr. Manasseh. That was quite huge. I'm sure that our audience would learn from this for those who are not concerned with what the laboratory do. Would you want to add something, Wayne?
Thank you. Yeah, that was actually quite comprehensive. I would like to say that it's one of the essential services and has become quite a large part of diagnostics and determining disease movement, disease epidemiology. Many years ago, before we had the technology and the capability of the laboratories now, much of disease tracing, disease control was based on doctors and clinical diagnoses. Now, with the capacity and the abilities that are available to us today, we can actually supplement those clinical diagnostics to a point where things like virus outbreaks are easily traceable, from one part of either the country or even across borders. Laboratories generally make the life of medical practitioners that much easier and faster. Thank you.
Thank you very much. Interestingly, a lot of information going out here. I don't know if you want to add something, Joanne.
Thank you very much, Lucy, and the audience that we have. What I want to add is that besides diagnosis and mapping disease patterns, the lab also plays a major role in training. We have people in colleges and universities who come through the labs for training purposes. So the main thing that comes out of that is moving technology from one generation to another and improving the services that the lab can offer. That's what I wanted to add. Yes.
Okay, thank you very much, great panelists. Just to like what Mr. Manasseh said, you see the role of lab is becoming bigger and bigger. Just apart from getting to know that this is a state of one's health. Again, that caught me because you can sit in the house and think you're fine, but except you go to the lab and you are tested, you cannot determine your state, because that lab will not help to find out if there are things in your body like unknown, looking out for maybe causative organisms that in the system. And then the fact that we are playing a critical role in determining the pattern of disease, in surveillance. These are all the issues we are going to be diving today in this session. Thank you very much, the panelists. So the next question directed to Wayne, if you don't mind. Are there still existing gaps based on your practical examples? You work in the lab, you are involved in surveillance. So from what you can see, are there still existing gaps in terms of our preparedness? Because I know that we have policies out there, we have guidelines from WHO, national policies telling us on action plan for public health emergencies. And then there are a lot of support. But the question now is that, based on what you can see, do we have existing gaps? If the answer is yes, then what would be your recommendation in terms of bridging those gaps in preparedness towards any emergency? Over to you, Wayne.
Thanks for the question. There will always be a gap, especially when it comes to the unknown. If you look at the last 15 years or so, we've had a number of different outbreaks. We had the Ebola outbreak in 2017. We had the novel influenza outbreak in 2009, 2010. And everybody, I'm sure, is familiar with the SARS-CoV-2 pandemic that really affected the entire globe. If you look at these different outbreaks, there are certain gaps that we are still now unable to fill as a laboratory or a laboratory network. Many things have been strengthened over time, but some hurdles that we keep coming up against are things like international communication. Often you'll have, for example, in the COVID outbreak, you will have communication channels that flow very well in one direction, but you will have a very slow communication channel in return. Unfortunately, those can't be controlled. As much as the lab can disseminate information, You know, as you know, getting information back isn't always freely given between international stakeholders. What I will say is that the discovery of pathogens all over the world is much speedier now than it used to be. We've got technology that can really delve very deeply into any kind of sample that we can gather to actually determine what is in that sample. And we can then analyze those different results to be able to pick up what might be causing the disease that we're looking for. So those improvements, thankfully, will keep advancing, both within our countries as well as into the international environment. But we will hope that the weaknesses, mostly, like I say, practicing outbreak situations, communications between different government departments within a country or between international stakeholders being very, very important as well. Hopefully those can be strengthened as time goes by. I think the laboratory technology itself is adequate to do what we need it to do. It is more the support structures for the laboratories that need a little bit of enhancement in that situation.
Okay, thank you very much, Wayne. So interestingly, communication is critical in terms of preparedness. And again, it's a team thing. It's not, it has to involve the whole team players, key players in terms of the public health space. So we got the fact that we needed to strengthen our communication, even when we have some technologies in the lab, but it's not just lab. We have other supporting teams that's supposed to, you know, correlate and work closely with the lab in terms of preparedness. Thank you very much, Wayne. We have another question here that we want Joanne to say respond to. How would we enhance and strengthen collaboration and partnership among key players in emergency preparedness? Like I said, if you look at the emergency response framework by WHO, it dictates, it highlights all the strategies that we need to embark on when there is outbreak or emergency. And there are also critical players. So how do we strengthen this collaboration among these key players in emergency? What will be the role of lab? How in strengthening, in working with other key players? Joanne, will you want to take this question?
Okay, let me give it a shot. For collaboration, number one, you have to know the people you want to work with. You have to know each and everyone's role when it comes to outbreak preparedness and any pandemic. And after you have to have a memorandum of understanding. You say, this particular team is doing task A, the other team is doing task B. Everyone can't do the same thing because you'll be having duplication of the work that is going on. After that, you have to get to know the resources you need to ensure that at the end of the day, you actually have the results that you intend to have. And you see, at the end of the day, we're asking ourselves, as a lab system, are we everywhere? Are we available everywhere when we are needed? If we are available, it means we have made a collaboration in a way, everything is seamless, that there's no gap that is found there. Then, as we make collaborations, we have to check what is the demand of the market today, because technologies are changing, diagnosis is also changing with technology, and there's improvement of machines every time you turn your head. So you ask yourself, are we adapting to the changes that are there? And when we are adapting, whom are we working with to ensure that we are up to speed with the changes that are there that are needed? Then in whatever we are doing in the collaborations we are having, is the system responsive? Are we seeking opinion of the public to get the gaps that are there and being able to meet the needs that the people need? Because there's a point you'd find that there's a new disease that has come up. There's a need for development of kits. Is there somebody developing kits? Is there somebody distributing the kits and marketing? Is there somebody doing QA, QC on the kits? So when you have all these things brought together, it makes it easy. And also working with the international community, because every country has a neighbor. And usually the borders bring in different type of goods. You will have people coming in, you will have diseases coming in, and we learned from COVID. Really, COVID was not working in on its own. It was working in through people. So if you're having the borders knowing that, oh, we are having an outbreak, and there's a need for this outbreak to be addressed, then you'd find two nations working together to ensure that the disease is not only diagnosed on time for response purposes, but it's also contained within a particular place. And that one also leads to ability to map the disease.
Okay, thank you very much, Joanne. That was quite in-depth. You mentioned a couple of parameters that we need to look out for. We're talking about collaboration. First is the importance of mapping, stakeholders mapping. You know, you come to implement in a country, you are able to map out who are those collaborators, who are those on ground, what are they doing? So those roles will be very clear, you know, after following the mapping, what are they bringing on board? And then demand for the market, what is the need, you know, of our clients? I'm happy you mentioned that. And then I think when we spoke about the customer, so the public health physician, they are the customers. We have the DSNOs. Those are people who work in public health setting. So it's fine for us to know who are those key players and see what they are bringing on board. So there's no duplication of efforts. We'll be able to, you talk about adaptability and then system response. You said something very critical that will not exist alone. We have neighbors. And these pandemics or these diseases we're talking about, they move through human beings. So as far as there's that cross-border, that movement between one country or one place to another, this will continue to move and then spread. So it's important for us to work together and see how to, you know, address all those factors that you have just mentioned. Thank you very much. And that is why the IHR expects that there should be this capacity in country to be able to detect and report to the international community through WHO. So when we mount out surveillance, is one of the key things that we should be able to address. Thank you very much, Joanne. Please, our audience, please, thank you for being there. We want you to please continue to send in the questions. I see that questions are coming in. We are going to come back to them, after this discussion with the panelists. Thank you. So the next question is, how can we leverage the ongoing intervention? And Mr. Manassin, I want you to please take on this. How can we leverage the ongoing interventions by critical stakeholders in strengthening public health laboratories, for this emergency preparedness? We recall that even from every one of us, we know that we have key players, we have donors, we have many partners. Talking about strengthening lab for this preparedness, how do we leverage already the resources or interventions already going on in the country? Over to you, Mr. Manassin.
Well, one of the things that has helped laboratories all over Africa, let me say, is the flow of resources from the developed world. This is because the developed world know that if diseases are prevalent in the underdeveloped world, it just takes a few hours. An aeroplane has flown from one part of the world to another, and they know that they are not safe. So they have brought in a lot of resources into underdeveloped countries to develop facilities. Now, some of them came to help develop particular diseases, to take part in particular disease control activities. For example, the US created PEPFAR to deal with HIV. There are other organizations that are dealing with polio. There are other organizations dealing with TB, malaria, and so on and so forth. Now, these people are interested in getting laboratories that function very well, that produce results that is very, very necessary and essential, and that the systems work to be able to respond to the scourge of these diseases. Now, some of the facilities used are not just exclusively for those diseases. For example, a simple microscope that you can use for TB, you can use the same microscope for any other thing. If you have a PCR machine to do a viral load for HIV, you can as well use that same machine to do a PCR looking for COVID, and so on and so forth. So what the developing countries need to do is to make sure when these resources come, they make sure they use it to strengthen the laboratory facilities in terms of getting the appropriate equipment and make it available for all services. What the message that was sent is that in these developing countries, less than 30% of health facilities have basic laboratories that meet their basic needs. You can see, it means, if you take what Wayne said, if you don't have those things, the clinicians cannot operate well. They cannot even detect diseases because some diseases are subclinical. Some diseases even needs laboratory data before it can clinically be diagnosed. So it is an important thing to do, but we must make sure that whatever resources comes to strengthen laboratory as a service unit of every facility, not to localize and insist that you are only going to develop a particular lab. You make sure whatever facilities are available are open for services. But the important thing is training. Every activity that anybody wants to use to support laboratory services, we must train people competently. We must have, as Joanne said, quality assurance, quality control activities. People must know very well. Otherwise, we could just be wasting our time and giving resource information that are even detrimental to health. So these basic things about human capital development, developing good systems for the laboratory operations, and very importantly, to also develop, I like what Wayne said, communication. Labs should be able to communicate with each other so that within a short time, if a facility, an item is missing here, somebody can easily, you can call another lab, or you can just pick a specimen and send to a lab that you know is competent that can do something. So all these are infrastructure that we need to use the resources coming in for laboratory services to make sure we develop them for the, especially African countries.
Thank you very much, Mr. Manasseh. Quite elaborate, and he spoke the need for us to integrate, leveraging on what we already have on ground. So for everybody who has interest or has is a key player in the laboratory, we have resources already, and even the donors are preaching for integration. They don't want duplication of efforts, as even as the funds are dwindling. If we have microscope, we don't have to tie it to TB. We can also use it for malaria and other testing. Likewise, all the sophisticated equipment that is supplied. And this can be optimized because even the equipment that are supplied, most of them are not optimally used. They are running below, their uptake, below their capacity. So it would be nice for us in the lab in terms of preparing for this preparedness. Yeah, strengthening these laboratories. Let us know that we have resources already on ground. We don't have to procure everything. He mentioned about networking, mapping these laboratories. Where are they? and then do that kind of networking between one lab to the other. Thank you very much, Mr. Manasseh. And then the key critical issue on capacity building, developing the human capacity that we have. So it would be nice if we have the opportunity wherever we are, in terms of preparing, let us look at what we have in-house and see how we can optimize, the resources that we already have. Thank you very much. Please keep your questions coming. Thank you very much, our great audience. We know you are there. Please, wherever you are joining us from, feel free to drop your questions and your comments on the Q&A. Yeah, so the next question will be, we've talked about what we have on ground. Now, talking about preparedness for the laboratory, how broad should this emergency response plan be in order to address, I think one of the panelists mentioned to know what is the need of the customer. So like now we're praying for what we don't even know. That's why it's emergency. It could be it could be anything. So when you want to talk to us about how robust should this plan be in order to be able to address or whether the impact or minimize the impact if anything like emergency struck in any of our countries. Over to you, Wayne.
Thank you. The best way to really explain that is to expect the best but plan for the worst. You should be able to detect anything. The idea is that the disease is first going to come in from a clinical signal, right? And it is most likely going to mirror something that you've seen before. It might be influenza-like illness. It might be a hemorrhagic fever. But once the known causes have been eliminated, you will need a robust laboratory system that will be able to do some investigative and discovery processes, whether that is through a partner or whether you have the capacity on hand. The next step is really finding out what that unknown is. Once that's been done, it needs to be reproducible. You might have something in your laboratory that might have affected those results. So if you can reproduce those results, it means that you've got something that's actually worth giving back to the stakeholders, whether it's clinicians, whether it's the Department of Health, whether it's a neighboring country that is asking for this particular process. So, the new technologies, as I mentioned earlier, really have a huge amount of capacity for detecting anything and everything. The difficulty now, of course, is trying to figure out what is noise, what is extra information, and what is the information that you want. What is causing the disease? What is affecting the health of whether it's animals, whether it's humans? The vast amount of data that we're able to generate nowadays can also complicate that. Thankfully, a good example of what we were able to do is in 2020 with the COVID outbreak. There was influenza-like illness. It caused pneumonia. We managed to then isolate an unknown virus. We were able to sequence that virus in a relatively short amount of time. And once that information was disseminated, the entire world was then alerted. And within a short amount of time, we were able to procure kits against this new virus, commercially standardized PCR assays. So we were, if you could also develop your own in-house assay, and a lot of laboratories did do that. But they were able to then produce a reproducible result, something of quality that you could rely on. And from there, you had the dissemination of those tests to either neighboring countries or fellow laboratories within the country. So, yeah, I hope that answers the question.
Thank you so much, Wayne. It's a lot. I see that we're trying to see how we can meet our time. So thank you very much, Wayne. I think you've made a couple of points here in terms of you say you should prepare to detect everything and anything. And then from the discussions that you have actually mentioned, the fact that what is the causing diseases. So when we are prepared for detecting everything and anything, that means we should have this in-house capacity, like I know that the IHR stated the fact that we should be able to detect at least the first 20 priority diseases. So each country should be able to work towards getting that robust plan to detect anything and, everything. And then the issue of quality results, you've emphasized that. And I also know that there's this issue of multiplexing, sequencing, so that can get whatever it is to be able to, detect that. Thank you very much, Wayne. Just quickly, I know that EHEalth Africa is actually supporting the WHO effort to strengthen global polio laboratory network across some African countries. So we're doing like equipment and consumer procurement. We're doing equipment installation. We're supporting them with civil work and IT infrastructure upgrade, as well as constructing some supply hubs. So this is just to effectively help select these countries that are selected to confirm the circulating, vaccine-derived polio virus, which is actually, causing an outbreak in some localities. So now, Kemri happens to be one of the sites that we support, even NICD. But Joanne, would you mind to tell us how effective this EHealth Africa support has been in terms of your work? Can you please say a word or two in that direction? Thank you. Over to you, Joanne.
Thank you very much. Now, when you talk about effectiveness of a response, there are very many factors you're considering. You're considering skilled personnel, access to technology, funding, and the overall health infrastructure that is there. For Kemri already had skilled personnel and already had infrastructure in place, because we had renovations being done in the lab that took almost 24 months. But during the time we're having these renovations, we had a lot of damage of equipment. We had to move, in your lifetime as a laboratory staff, sometimes you go through the whole of your work life without moving a lab. We had to move a lab from one campus to another, a whole 6 sections of a polio lab. That was a very challenging thing. So we had a lot of our equipment getting damaged, because some of our equipment are as old as 1986 old, or we have one of my favorite machines, which is a 1972. You know about it, Lucy. You've met Daisy. She even has a name. Now, when we had all this trouble, EHealth Africa came really in great help with collaboration with WHO collaborating with EHealth Africa, were able to give us some equipment, and we got from biosafety cabinets, because everything got damaged. We had PCR stations coming in, the complete set, gel electrophoresis, conventional and real-time PCR. We also had thermocyclers, centrifuges coming in. So we actually had some challenges. Some of our work stalled a bit. We're moving our samples to Uganda. That's when we're talking about collaborations. Uganda really came in handy when it comes to assisting us when we had a breakdown. But when EHealth came in, all this was sorted out. And not only for the equipments we had lost, they also came in to upgrade what we already had, because we didn't have a sequencing platform, and they were able to help with that, not only for equipments, but also for reagents. So that's a big step, because when it comes to diagnosis of circulating vaccine-derived polio, it reduces the turnaround time for results. That is what EHealth Africa has done for us. If you came to our lab before, we had beautiful new labs, but we had problems with equipment. And that is how we appreciate them.
Thank you very much, Joanne, for that. So we're happy to hear that we improve your turnaround time, which is critical. We're going to talking about quality result. We're talking about a result that is accurate. You know, after being accurate, is it reproducible? And then is it timely? So you can have an accurate result that is reproducible, that comes in when the patient is already dead. So that result cannot be said to be quality. So it's good to hear that your turnaround time improved. So thank you very much, great audience. Thank you for staying back. We are aware you are there reading out some of your chats, you know, I see that you're bringing in something. So we're coming back to that shortly. So let me take the next question. This will be directed to Mr. Manasseh. Now we're talking about preparedness, and from every indication, from what we have discussion we have had so far, critically is the laboratory data. Because you need this laboratory data for planning and programming. So there is this paucity of lab data for planning and programming, for forecasting and decision making, which is detrimental and actually counterproductive to laboratory system strengthening efforts. So Mr. Manasseh, we want you to discuss, shed light on the way forward. How can we implore and promote data management? Over to you, Mr. Manasseh.
Well, data management is much easier now.
Okay.
In those days, you have to write things on paper, you have to have files, you have to keep them, and sometimes accidents happen. But thank God, the computer had come. And apart from computers, there are so many communication systems now. A simple smartphone in your hand is a very, very good instrument that you can harvest data, store data, transmit data, and so on and so forth. So what is necessary now is for every country to have a centralized system of gathering data, storing data, so that they can easily access this data for whatever purpose they want to do. It is very, very important for all laboratory staff to be literate with computers and even some level of programming, so that they can properly harness data, store data, retrieve data, and can also send information as may be required. Now, this data is very central to whatever you want to do. If it is a physician, he needs that laboratory data for his work. If he's an administrator, you need that laboratory data to guide your decisions. Policymakers need data to influence how their policies are formulated in solving problems. So data is very, very important. But let me make a very important thing. You see, if we do not create a laboratory network where we know not just the location of the laboratory, but the personnel the laboratory has, the equipment they have, what they can afford to do, what they cannot afford to do, it becomes much, much easier for us to generate data, to store data, and anybody who is looking for an information can easily just go to a database, pick the information he wants, and off he goes. So the first data that we will need, I wish all the labs, wherever they are located in Africa, can be put on a database and they can be connected. It's very easy to connect them now. The internet is there. I'm using my phone to capture data and send it. So even remote labs can easily send information with just an internet. You don't need big gadgets in your offices, but for decision making, for even governance purposes, we must have a comprehensive centralized data system. But let me say this, you need political will. You must have political will so that resources can be channeled to ensure that this data infrastructure is put in place. It's very difficult to do, but the technology is very simple now and easily accessible.
Thank you very much, Mr. Manasseh. There's a lot you have said, but the summary is that we wish all the laboratories could be properly mapped and, with showing their location and their capacity, which also feeds into that expectation of international health regulation. So when this is done, you know what we have in country or across Africa, what the capacities are, and how you can actually do the networking that we actually talked about earlier. Our time is fast spent. Just take one more, then we'll now come to our Q&A. Quickly, Joanne, could you please talk about the integrated sample referral? Now we talk about locations of lab, where they are. Can you just throw more light how that is a tool? Now we don't have enough resources, but we can do sample transfer. Then how can this sample referral network, serve as a tool to increasing the access we talk about and diagnostic coverage for the epidemic preparedness? Over to you, Joanne.
Okay, thank you very much. The sample referral network, the thing it's supposed to do is to provide a framework for effective, efficient, and coordinated timely diagnosis. When you know the number of labs that are there and you know the specialty for these particular labs, it reduces the time between the time you collect the sample and referring to a particular lab. Because if you already have a database of labs, as Manason said, and you know this particular lab does diagnosis for this pathogen, you don't have to think and ask, where is this sample going to go to? You'll move the sample from KEMRI and move it to NICD, knowing that they do this particular test. And this one will increase access to offsite diagnostic testing, because if you're not able to do it, you move it to the next level. Then when it comes to timeliness of results, when you already know where a sample is moving to, the results turn around time for the results will actually be reduced. If it's something that you could have taken 14 days, you'll actually be having between 9 and 12 days, for example, because you already know what to do. And then the quality of the diagnosis will be assured, because you already know that this is a certified lab and it does that particular function. And also, during transportation of sample from one facility to another, you will have quality sample moving from the patient to the diagnostic lab, because you are having reduced exchange of the sample between one hand to another when you're looking for where to get it. And also the security of the sample will be assured, because you will know exactly where it went to, when it left the patient, when it was moved, and when it reached the lab that you wanted the diagnosis to happen. And this one generally will increase the efficiency of the diagnosis services.
Thank you so much, Joanne. I know we're in want of time. Please, thank you so much for that. So that we don't leave out our audience, we'll see some questions coming in. Try to attempt to take a few of them as time permits. So the first question here is saying that is from Kato, from Kampala, Uganda. He said his question is, how can laboratories in hard-to-reach areas be invested into in terms of infrastructure, equipment, supplies, and information system to ensure adequate and sustainable resources and capacity? So try to ask, how can they get financial support for upgrade? I don't know, any of the panelists want to take this question. Mr. Manasseh, would you want to take the question? Hello? Hello?
I think he's dropped off the call.
Okay. All right, so who wants to, among our panelists, who wants to try to respond to this question? Just talking about how they can get resources. So, yeah.
Well, I'll give it a go. It's a little bit of a difficult question because that's going to differ from country to country. It really does come down to how your health department values the speed at which they want to get results out of their laboratory system. The more you decentralize, the faster your results will be generated. The downside, of course, is that it's harder to monitor all of the different labs, and then also, of course, the communication and the data gathering can be a little bit of a challenge when it comes to lots of laboratories in different parts of the country. Of course, having a single centralized laboratory makes data gathering really easy, but then you have to worry about getting your samples from the remote lab to where you are. So you can also look at applying to external partners, especially people that are heavily invested in whatever question you're trying to answer. There's huge amount of funding available for TB, for HIV, polio eradication. So again, it's a little bit of a difficult question to answer, but I think the best way to go is try and figure out what question you're trying to answer. Is it a speed thing? Is it a detection thing? Is it a diagnostic capacity? And then you can look at either going to the Department of Health or partners, for example, the Bill and Melinda Gates Foundation, WHO, if you fall into those lines. And then it comes down to actually getting your resources to the laboratory site. If you've got poor roads, that's going to be a little bit more difficult. If it's in the middle of a dense forest, it's also going to be a little bit more difficult. So you've also got to do some site selection along those lines if you have the funding available.
Thank you, Wayne. The next question is from an anonymous. He said, thank you very much for the great insights. My question is, do we have any manufacturing company in sub-Saharan Africa that produces malaria RDT and COVID-19? So I'm not sure if you have that information. Who wants to respond to that? Do we have in sub-Saharan Africa?
No, I'm afraid I'm not sure if we do have that.
Okay, so please, you do well to follow us. We'll try to respond to some of these questions through other social media platforms. But yes, Mr. Manasseh, welcome back. We may be able to have answer to this question now. I know there's one, I think Morocco, during the ASLM conference that has something around COVID-19, but we can verify that and maybe get back to you if you have your details. Then the next question is why do, okay, so public health logistician manager from Bismarck is trying to find out about the elimination of variance in result issued out of one laboratory to another on same sample. What is the Biomedical Sciences Council doing to unify or standardize results? So talking about when you have one sample to send to different laboratories and you're having different results, that is the result not being reproducible. So what is the Biomedical Science Council doing about that? Mr. Manasseh, we want to respond to that quickly. Our time is up.
Well, there are so many reasons that one will happen. You can have, well, it also depends to what extent is the difference. There are differences that are allowable. But the first thing about quality in any country is that the equipments that are used in that country are validated so that they all work similarly. Again, the reagents that are used in the country are validated. Sometimes people buy equipments that are not good enough. People buy reagents that are not of good quality. And you find two different labs using two different systems that has not been validated. I've had this experience, and we know that there are many equipment that should not come into Nigeria, but they found themselves there. So this is a very common thing. And therefore, the first thing about quality of result is that, because when you are validating, you also compare each equipment or each system with the others, and they must operate within acceptable ranges to avoid this kind of thing.
Okay, thank you very much, Mr. Manasseh. So it's talking about equipment validation as well as why we need to maintain quality. So when we start implementing quality management system, we have the proficiency testing, the facilities registered for PT, and doing the form of EQA. That takes care of that standardization. So no, I hope that is well answered. So thank you very much, great audience. We have more questions coming in. I don't know how many we'll be able to take. Our time is up. Just to round up, so a last word from Mr. Manasseh, just for us to round up. We thank you very much for staying and being part of it to the end. Sorry we took into a little of your time, but that's because the conversation was getting interesting and we're having some questions and learning. So, Mr. Manasseh, can you have a word from you?
Well, for us to be prepared for pandemics, we must develop good laboratories, and those laboratories can be accessible. 30% laboratories is not good enough. It means there are too many people far away from laboratories. So diagnosis cannot be done in time, therefore they become reservoirs of diseases and they help in spreading disease. We need political will to mobilize resources to develop laboratories. We need good policies to be in place for laboratory services, and we need excellent laboratory infrastructure. Finally, a very good networking of laboratory and an excellent information system for laboratory services are sine qua non to developing a preparedness for pandemics.
Thank you very much, Mr. Manasseh, for that wonderful closing remarks from you, I'll say. Please, audience, don't forget to follow us on our social media handle for more insightful information. Sorry we could not attend all the questions because of time. I would like to appreciate our panelists, for their time to be here with us. We thank you, the audience, and great participants. We saw the comments that are coming in from the chat box. Thank you from everywhere, and then we appreciate you. We would like to appreciate, most importantly, also the media crew, people who are working behind. Thank you, Moshood. Thank you, Elijah, Favor, and all the crew members for making this outing a success. Please, we'll see you in our next webinar, and bye, everyone.
Thanks very much.